The next product is the mouthwash. Mouthwash is an aqueous solution used in the oral cavity and is aimed to be in contact with the mucous membrane for a short time, and it should not be swallowed. Mouthwash should contain ingredients that act as refreshing agent, antiseptic, local analgesic, and astringent. Mouthwash is actually being used widely cosmetically, okay, so for cosmetic purposes, because it is said to be able to reduce the bad breath or halitosis. It would be very interesting if you read the history behind halitosis and how the term was coined. Okay, I would suggest to you to Google it, and you will have some idea when or who started the problem of bad breath. So there are several common types of mouthwash, which are cosmetic mouthwash, okay, such as Listerine, antiseptic mouthwash, fluoride mouthwash, alcohol-free mouthwash, and multi-care mouthwash. The antiseptic mouthwash are used, okay, usually post-operative or after extraction of tooth to prevent infection at the site of extraction. Okay, so mouthwash is usually used in the oral cavity, and usually the antiseptic mouthwash will contain chlorhexidine gluconate, which is used to prevent or treat bacterial infection, as I mentioned earlier on. Fluoride mouthwash contains sodium fluoride that acts to strengthen the teeth and prevent tooth decay. While multi-care mouthwash, or some brands use the term total care, has antibacterial agent that prevent gum diseases and reduce the build-up of plaque. For mouthwash, actually, we have several different applications, but the most important for pharmaceutical use, the antiseptic mouthwash, okay, to ensure that that infection does not occur at the site of operation. Chlorhexidine gluconate 0.2% mouthwash is used as post-operative antiseptic agent, and there's another type of mouthwash, tranexamic acid 5%, is used after surgery to prevent post-operative bleeding. Okay, so this will help to stop the bleeding of the gum.